An Achilles tendon tear is one of the most dreaded injuries for athletes, but it can happen to somebody of almost any age. The most common age where the Achilles tendon tears is usually somewhere between about 28 to 30 and up to about 65 or 70, so it's a big, broad range. The most common person that'll tear a tendon, though, is probably the weekend athlete or the gentleman who's been active in sports throughout his life but hasn't been as active, and then somewhere around 35 to 40 goes out, plays basketball or has a sports activity, and then feels a sudden snap or injury in the back of his ankle. And the most common complaint that we'll hear when somebody comes in is that they've been struck by a bat, or they think somebody hit them with a ball, and then they look back and nobody's there. And then they can't walk normally afterwards. Sometimes it's not very painful, but other times it can be significantly painful. Sometimes these can be missed because the person that has the injury thinks they've sprained their ankle and they're not sure what's happened and realize that they can't walk normally. The Achilles tendon is actually the muscle or tendon combination in the body that probably sees the most force of any other muscle. Sometimes up to 12 times your body weight goes through the Achilles tendon. The reason that it tears can be several things. Sometimes the tendon can be perfectly healthy and the amount of force that goes through it is so great that it'll cause it to tear. I've had patients come to me that have been trying to push a golf cart up a hill after it stalled or was stuck, and it was at that moment that they were putting maximum pressure that the Achilles tendon tore. The Achilles tendon attaches to the back of the heel, and the mid portion of the Achilles is a weak area where we believe the blood supply comes in from above and also from below out of the bone, and then it reaches an area in the center of that tendon where in that area the tendon doesn't quite get the same amount of nutrition, and over time it can weaken. And several studies have shown that there is definitely a blood supply issue right in that central area of the tendon. For that reason, this is also a place where tendonitis can occur, and often tendonitis happens beforehand, and then the Achilles tear happens after a huge amount of stress occurs. Now, an Achilles tendon tear is devastating because that tendon is required to walk normally and to be able to push off the foot. And there are two ways that it can be treated. Really, neither one of these should be treated at home. If an Achilles rupture occurred, as quickly as possible, you should be seeing a physician or seeing a doctor and evaluating whether or not this is actually torn. If you're not certain, it's worth that visit to be able to check on this. And what your doctor will recommend when he sees you is first an examination, and usually within a few minutes of examining your ankle, he or she will be able to tell whether or not you've got a tear. And if you do, what's going to be felt is a defect in the back of the heel or in the back of the ankle where that tendon has torn. And then also you won't have the flexion strength of your ankle. You won't be able to push down on your ankle. When this occurs, and it's been confirmed, there are two ways that he may or she may treat this. And those typically are going to be either surgery, and in the United States of America right now, surgery is by far the most common treatment for an Achilles tear, or non-operative treatment, which can be use of a cast and special types of boots, fracture boots or walker boots that come up to your ankle, up to your knee, and that control the position of the foot, and a combination of those things and physical therapy. In many parts of the world, that treatment is first-line treatment and has been successful. One of the reasons that we use surgery often in this country is because if a patient has a non-operative treatment, or they choose to not do surgery, in many cases those patients will have a re-rupture within the first 6 months, and the re-rupture rate has been rated at about 17% by some studies, or as high as 17%. When the Achilles tendon is repaired, then it typically doesn't cause, or a re-rupture doesn't occur, all the way down to around a 1% rate. And so there's a very, very big difference between those two. However, surgery is higher risk, and patients who have surgery to repair their Achilles tendon need to be aware that there's a significant risk of infection and also of wound complications or problems after surgery, and the recovery process takes some time. Recovery from Achilles tendon repairs usually requires a cast for 2 weeks, sometimes up to 6 weeks, and then use of a fractured boot or a walker boot for up to 10 weeks after surgery. And during that time, physical therapy is usually an important part of the treatment. Most patients can expect that it will take about 6 months before the repair has completed itself and muscle strength is coming back and sports activities are again possible at the level that they would have had before the injury. In most instances, an Achilles repair, if done properly, can restore you pretty close to the same level of athletic function that you had before, provided no complications occur. There are a few things that you should do to help prevent these from happening, and I think those are worth mentioning. One is, if you are athletic and try to do sports activities on a fairly regular basis, then conditioning your Achilles tendon is important. One of the things that you can do is make sure that you always warm up and cool down during activities, especially before doing any explosive types of activities like jumping, pushing against things significantly, pushing off the foot, and attempting to sprint or just taking off sprinting, playing softball or other kinds of activities that are similar to that are usually when that occurs. Other things that you can do are stretching of the calf to maintain pliability and flexibility of the ankle, and then also definitely warming up for anything that you do. And I would recommend against playing heavy basketball or really strenuous sports if you have not been active over the previous 2 to 3 months prior to that time. And you should build up with moderate activity for several weeks before pushing yourself to a full activity.